Hi, I'm Hammer. Welcome back to Insight, and with me now is Taylor from Steppin' Up Physical Therapy, and we are here to talk about women's health today, right?
Yes, May is Women's Health Month, so no better time to talk about it than now.
Fantastic, and I see that you brought a model along, and I have heard we're talking about pelvic walls.
Yes, pelvic floor, yes, correct.
Pelvic floor, excuse me.
Yep.
So tell me more.
Absolutely. So women's health and pelvic floor PT is a specialty within physical therapy where we treat the pelvis as a bony structure, so the pelvis and how it comes together in the ligamentous tissue. But we also treat the pelvic floor, which is this red group of muscles that you see in the pelvic model that actually supports a lot of functional movement at the back. It helps with the abdominal wall support. It helps control bowel and bladder health, and a myriad of things that contribute to our overall health.
And is it recently, in the last 20, 30 years, that we started to consider those things and look at those kind of solutions?
Certainly. So it's a rather new field, and I think a lot of people are picking up information about it and understanding it. We're trying to get our name out there to make sure that women know that this is available for them. So many times we'll have women come into our office and say, man, I wish I would have known about this sooner. And that's what we're trying to do, is make sure that they hear this information to be seen.
And so is there a too late time? I mean, is this something that you can work with somebody even as they age?
Absolutely, absolutely. So we treat women for a variety of conditions, whether that is bowel and bladder incontinence, whether it's pelvic pain, sexual dysfunction, any type of dysfunction of the pelvic floor. We even treat pain with diagnoses such as endometriosis or interstitial cystitis, which is a bladder condition. And at any time in your diagnosis of those things, or no matter how long you've been having those things, pelvic floor PT can still help. It's never too late, you're never too old, or I've been having it for years, there's no way it can help. Getting in to see a pelvic floor PT can really be beneficial, even if it's been a long time coming.
And one of those problems being incontinence, and that can be worked with, right?
Correct, absolutely. Whether that's bowel or bladder incontinence, no matter if it's been going on for 1 week, 5 years, 10 years, if it's just been happening since you've had a baby or since a surgery, no matter what, pelvic floor PT can absolutely help and get you back in control of those things.
Now, Steppin' Up has a lot of locations.
Sure, it has 5 across Fort Wayne.
5 across Fort Wayne, and
Yes.
do they do this kind of therapy in all of the in all of the locations?
So right now we have pelvic floor specialists that are treating at our Southwest Clinic, our Sage Bluff Clinic, as well as the Laymeyer Road location. So those 2 offices offer this.
Do the majority of the people that are coming in for this kind of treatment come as a referral from their doctor?
Oftentimes, yes, but you do not have to have a referral. It really depends upon the type of insurance that you have, but you can come to physical therapy for any diagnosis with something called direct access, which is where you come to see us without a doctor's order. As long as your insurance is okay with that, you can come to us without that.
Now, are these muscles part of what they include when they're talking about a core and my lack of a core? No, I'm just kidding. Is that what they're doing?
You do have a pelvic floor too, but yes, so the pelvic floor actually contributes to so much more than just bowel and bladder support and helping with incontinence or to prevent incontinence, but it actually ties in to the lower back as well. So it comes into the tailbone area back here, and so it supports the lumbar spine and tailbone, as well as helps with the core to support the back.
My pelvic floor helped save my life.
Yeah. Really?
Someone was looking at x-rays and noticed that there were lymph nodes that were growing.
Okay.
And that's how they found my leukemia.
There you have it.
And so, yes, I'm proud to say, yes, I do have a pelvic floor.
Absolutely, sure thing.
So if somebody is having these kind of problems, is this something to work on and try to fix that's going to take months and months and months of care?
So good question.
Depending, right?
Absolutely. So it's going to be per the individual, as far as how long it's going to take to really improve and see results. If it has, I will say, talking about the length of time that you've been experiencing symptoms, oftentimes it's going to be a little bit longer of a treatment plan. Not always, but we really want to get down to the root of what is causing the issue, so then we solve it from the inside out, and these things don't just keep happening over time.
Since we're talking about women's health this month, what are the most common injuries or things that you see women for different than you'd see men for?
Sure, certainly. So a lot of times we will see pelvic floor incontinence, which really can happen in both male and female, but we see a lot of urinary incontinence. A lot of times we will see women postpartum, so following the birth of a child, whether that is vaginal birth or cesarean birth. Even with a cesarean birth, the pelvic floor can still be affected, and so there can be incontinence, there can be pain associated with that if there was any type of perineal tearing, or with cesarean sections, there can be scar pain, scar tissue adhesion, and we can work on all of that as well.
Okay, fantastic. Well, you have made us all smarter, and hopefully you've solved problems for some people that are going to give you a call, and they're going to start that conversation. Tayler, thank you so very much. And if you would like to check out Steppin' Up Physical Therapy, well, you can head over to their website or call 260-408-6093, and you can also go to one of their 5 locations currently on your screens. Insight will be right back.